The Pacific island of New Guinea is 4 times the size of the UK, with most of its lands covered in verdant tropical rainforests. And these rainforests are now the third largest remaining left on the planet. They're also globally important for climate change because their trees hold around 6% of all the carbon locked up in the world's forests. They're home to myriad human cultures, with most of the population living in small clan-based communities, speaking between them around 800 languages, so that's a fifth of the world's total. And alongside this amazing cultural diversity is an incredible biodiversity, with species in New Guinea found nowhere else on Earth, most famously its emblematic birds of paradise. However, this eco-cultural diversity is threatened by commercial logging driven by global commodity demands emanating from our industrial societies. And alongside this environmental crisis is a health crisis. So, Papua New Guinea, where I work, has the third worst combined health metrics outside of sub-Saharan Africa. And there are many reasons for this. But chief among them is that over the last 150 years, New Guinean communities have been exposed to a range of diseases they've no experience with. Additionally, the medical system they inherited from colonialism disproportionately cited medical services in towns far away from where people lived. For example, this family in the forest in Wanang would have to have walked for multiple days in 2017 just to buy antibiotics or visit a clinic. So, in response, Sussex Sustainability Research Programme has been working in Wanang in an indigenous-led alliance to integrate action on biodiversity, health and conservation. The story of how we've done this begins with this Wanang elder, Philip. So, as a young man, he left the forest to go and work on road construction. And then he saw with his own eyes the destruction caused by deforestation and the intrusion of industry into the forest. He saw destruction of the natural environment and destruction of indigenous lifeways, so he returned to his forest home. Years later, when the logging frontier began to reach his homeland, he mobilised his community and clans around them and successfully declared 100 square kilometres of rainforest as the Wanang Conservation Area. So, a major conservation success. But Philip understood that to make this success hold, he would have to also make sure that conservation brought basic development benefits to his community. So he sought out allies. As part of this process, Sussex University organised a community planning meeting where clans determined that introduction of health services was the Conservation Alliance's priority. In response, in 2018, I led a multidisciplinary team from Brighton and Sussex Medical School and New Guinea Bintang Research Centre to Wanang. We travelled for 4 hours up this seasonal logging road in a 4x4 and then went through the jungle for a few more hours. In Wanang, in this temporary treatment structure, we examined patients, we treated them, and we also listened to the community in focus groups and interviews to find out what was really affecting them and what solutions would work in this setting. We then came back to the UK and we used that research data to successfully obtain funding from the Darwin Initiative, a fund of UK government. This allowed us to return, train the community in medical evacuation and trauma care and other basic skills. This is partly a stopgap measure where we set out to establish permanent primary care in the community, which we have now done. So, this is the Wanang Clinic. It's been staffed, supplied and built by our Darwin Initiative grant, and it's providing medical care for communities for 500 square kilometres. This picture was taken last year when we were doing a skin disease clinic there, and these people have walked in for treatment that morning. Previously, they'd have had no access to in-community medical care, but now, if they have, for example, a severe case of malaria, they can get excellent treatment from wonderful nurses such as Naomi here, working in the clinic. And this has some really valuable health outcomes. So we've seen a reduction in the neglected tropical disease yaws, and also an improvement in maternal health, for example. So a real health success. However, it's also incentivised conservation. The community at Wanang's resolve to defend its forests is strengthened, and it's also impressed neighbouring communities who previously decided to allow logging. They've now joined the Conservation Alliance, expanding the conservation area from 100 square kilometres to 150 square kilometres. This in turn is protecting 500 species of plant, 10,000 species of insect. And we know from fieldwork conducted by University of Sussex School of Life Sciences researchers working with in-country staff, going around actually measuring the trees throughout the reserve, that this conservation area is now protecting 1.5 million tonnes of carbon, which otherwise, if logged, would have substantially contributed to the climate crisis. So this is also a successful climate action. Now, so far, I've been talking about health, conservation, and biodiversity as though they're somewhat separate, but I want to build stronger links for you. So when I first went to Wanang, there was a high burden of disease, but what we didn't see much was diarrheal disease in the under fives. And this is a serious problem we expect to see in these kind of global health settings, but it simply wasn't there. And these two elders, Jeppy and his wife Rhonda, Jeppy is the chair of the Conservation Board, they're standing in the reason why we didn't see that diarrheal disease. And that's the Wanang River. This brings fresh water from upstream forests to the community of Wanang. And we know from work elsewhere in Asia Pacific that upstream conservation of forests reduces disease risk downstream, including diarrheal disease in the under fives. So it's not just that building medical services incentivises conservation, it's also that conserving the forest itself is a preventive health measure. And that's not just true locally. So, if the forests of New Guinea, remember the third largest left on the planet, if they're allowed to fall, then the amount of carbon released into the atmosphere will substantially exacerbate the existing climate crisis, worsening health outcomes for people worldwide, including as far as here in Britain. So, I'd love to name and thank all the people who've been involved in this work, from my fellow academics here at the university, across schools, to the young and old at Wanang who physically carried every single box of medication, every single sheet of corrugated iron, all the way from the end of the logging road through the jungle to where our clinic is based. But unfortunately, I don't have enough time to name them all. But I would really like to highlight the role of Indigenous conservationists and researchers. So, this is Dr. Francesca Dem. She's sitting in the herbarium at our lead in-country partner, New Guinea Middleton Research Centre. And her work, and the work of her colleagues, has been essential to this success. More broadly, the reason why this project has worked is because it's been a research action partnership between forest communities on the ground, our university, and Indigenous researchers like Francesca. In conclusion, the forests of New Guinea will stand or fall in one human generation. And what will mainly determine the outcome is going to be the tenacity and the resistance of forest peoples, and the work of Indigenous researchers and conservationists like Francesca. We, in Sussex Sustainability Research Programme, are committed to supporting them in their mission of preserving these globally important rainforests and improving the health of the communities which call it home.